Welcome to this edition of Best of the Best, where we interview the world's leaders in healthcare, politics, sports, and business while sharing their secrets to success. Now here's your host, Dr. J. Murray Hockings.
Welcome to this edition of Best of the Best. I'm your host, Dr. J. Murray Hockings, and today's show is going to be different because instead of having a guest on, we're going to answer questions from our followers on a variety of health topics. So let's jump right into the first question. Now, this question is from Angela in San Antonio, and Angela wants to know why doctors prescribe so many medications. It's a great question. So the short answer to that is that's how they're trained in med school. Now, they're trained in med school how to diagnose your condition, then prescribe medications. If the medications don't work, they perform surgery. That's it. See, so medical physicians are not trained in chiropractic, in acupuncture, nutrition, exercise, wellness, prevention, anything like that. They're trained how to diagnose, prescribe meds, and perform surgery, period. Now, have you ever heard of the old saying, if you're a hammer, everything looks like a nail? Well, in healthcare, if you go into your medical physician, you're going to get prescribed the medication. Simple as that. So the big question that you really need to ask is, who does that benefit? Okay, when all they do is prescribe meds and all they're trained on is how to prescribe meds. You can answer that question yourself as far as who that benefits. Now, medications are needed and save a lot of lives. However, no one who has any training in healthcare would disagree that we are over-medicating people. And the main reason for that is that medical physicians are not trained in alternative medicine. So when you go to them with a sniffle, a cold, or something else, it's not even in their bag of tricks or bag of tools to give you something natural because they're not trained in it. And the worst part is that instead of them saying, hey, John, hey, Mary, I don't really know any alternative methods I could recommend for you, but maybe you should go see a chiropractor, go see a nutritionist or somebody else. They don't do that. See, most of the doctors will poo-poo anything that's wellness, preventative, or natural alternative as unscientific. And again, that's not to your benefit, that's to your detriment. Okay, so when you choose to go to your medical physician for your health care, you need to expect they will prescribe you a medication or recommend surgery. Because again, that's all they're trained in. Okay, so I want to make sure you're aware of that. Okay, next question here is Robert from Tampa wants to know if taking multiple medications every day is safe. Well, again, the short answer is no one knows. Now, why do I say that? Because if you look at the way medications are approved right now by the FDA, okay, so say let's take a medication that a lot of people know, it's called metformin, which is for diabetes, okay? So when metformin, before it got approved by the FDA, they did studies on volunteers, right, in a study to see how it worked. Well, guess what? They were only testing what the effectiveness was for metformin, and they were only seeing what the side effects were for metformin, okay? Now, stay with me. So now you get prescribed metformin, you start taking it. See, so now at least you have some kind of an idea on what the side effects are, what the benefits are. Now, here's where it gets off the rails a bit. Now, when you're on metformin and then your doctor also prescribes a cholesterol medication, okay, now you're taking a diabetic med and a cholesterol med at the same time. Want to know the dirty little secret? There's never been a study done to see how taking metformin and cholesterol pills affect your body. It's never been done. So anytime you take more than one medication at the same time, you are a living guinea pig for the pharmaceutical industry. They have no clue how that's going to react to your body. There's never been a study done on that. And yet, how many people are taking more than taking two or more meds? So now let's go if you're taking 3 meds, 4 meds, 5 medications, right? There's never been a study. There's too many combinations of medications available than to ever do any kind of a long-term study to know how it's going to affect your body by taking multiple medications. Okay, does that make sense? Okay, now medications are man-made chemicals, and the more you take, the more stress you put on your liver and kidneys. Remember, these medications are not vitamins. They're not fruits, they're not veggies, they're not anything natural. They're man-made chemicals in a laboratory. Okay, so common sense should tell you that it's best if you never have to take any medications. But if you have to take some meds, you should take as few as possible. Does that make sense? Okay, so next one here is from Barbara from Salt Lake City. Wants to know, what are the leading causes of death in the United States? Okay, so this is a really interesting one. Okay, so the mainstream answer to this is that heart disease is number one, cancer is number two, and medical care is actually number three. That's the top three. But the truth is, the dirty little secret again, is that medical care is the number one cause of death in the United States, and it kills over 1 million people per year. Now, process that for a second. Over 1 million people per year are killed because of medical care. That includes side effects from meds, side effects in hospitals, unnecessary surgeries, oopses, accidents, all of that together. Now, this is proven and explained in a great book called Death by Medicine. Interesting title, right? It's called Death by Medicine. And it's written by Gary Null, who's a PhD, Martin Feldman, who's an MD, Deborah Razio, who's an MD, Carolyn Dean, who's an MD, and a naturopath. So again, this book is written by a PhD and 3 medical physicians. It's not written by me, okay? And it proves that medical care is the number one cause of death in the United States. So this should make everyone listening to this pay attention and learn how to stay healthy so you don't have to be a part of the medical system. And again, you do that by keeping yourself healthy, not having to go on medications, and all of a sudden get into that system, okay, which has very, very bad results for a lot of people. Okay, so Tony from St. Louis wants to know, what do I personally do to stay healthy? Okay, so a lot of people ask me this all the time. So again, first thing I want to say is I'm not a fanatic. Like I don't work out 7 days a week, 3 hours in the gym, and I'm some like a vegetarian and crazy. Like there's people that take it way too far, and you don't have to go that far to be really, really healthy, okay? So I don't smoke. Okay, I don't drink soda. I rarely eat anything with sugar. I don't drink coffee or anything with caffeine. I drink a gallon of water every day. I eat a lot of fruits, veggies, and meats. Very little bad carbs, so very little of the breads, the pastas, the rice, the chips, etc. Very little dairy, if any. I work out 5 days a week with free weights and light cardio. I have a smoothie every day, a protein with protein powder and super greens in it. I absolutely don't take any medications, either prescribed or over the counter, ever, for anything. And I haven't taken a medication in my body since I was 19 years old. And I'm 57 now. So that's no medications for the past 37 years. Now, my wife, Tracy, hasn't taken any medication since we've been married for the past 29 years. And our daughter, 26-year-old daughter, Tiffany, has taken no medications her entire life. Not a cough drop, not an aspirin, not an antibiotic, nothing in 26 years. Now you might say, well, how is that possible? Well, it's just learning how to live the right way, learning what to do if you do get sick, etc. So do we get sick? Well, rarely, right? But when we do, we have the philosophy that medications aren't even an option. There's no medications in our house. It doesn't even cross our minds to take a medication. So think of it like we get sick. It's like, I don't make you think, oh, I gotta go take a drug. No, it's not how it works. We'll take vitamin D, take some nutritional supplements, some vitamin C, drink a lot of water, and rest. And guess what? Magically, we get better with no medications. So I want you to think about this, okay? If everybody in the world lived their lives as far as their health the way that I did and my family did, guess what? Big Pharma would be out of business in about a year because nobody would buy their products. Right? I mean, you're taking their products because you've been told by your doctor that, oh, you got this symptom, take this drug, right? From the time you're born to the time you die, anywhere in between, there's a medication for you, isn't there? Okay, so listen to this. In 99% of the cases, taking a medication is a choice. It's not a requirement for your health, as there are lots of natural alternatives for most conditions. Remember, as I said above, your medical physician isn't trained in alternative medicine, so you typically will never hear about it from them. Okay, so you have to go to alternative doctors like me to find out your natural options. And sadly, not enough people do that. Now it's getting better. More and more people are seeking wellness care and not just listening to their doctor when they give them another drug, which is great. It's always good to question your doctors, your medical doctor, me, anybody you go to. It's great to question them. And you get to decide. You get all the information from all the sources, and then you get to decide what's right for you, okay? Okay, so here's one from Sarah from Wichita. She wants to know, what do I think about COVID-19, masks, and the COVID vaccine. Okay, so this is very, very controversial. So I could literally do a whole hour show on this. I'm going to kind of just hit some of the highlights and just summarize this. If you want more information on this, you can actually reach out to me personally. But here's the deal. Okay, COVID is the real deal, and it did kill people, and it's still killing people. So not denying that. But here's the issue, okay? The best way to protect yourself from getting COVID is by taking vitamin D and zinc daily. Okay, period. Okay, if you look at all the research and all the pros and cons, that's the simplest, easiest thing you can do to keep your immune system strong and fight that off. Remember, everybody, 99.6% of anybody who gets COVID, they survive it. So only 0.4%, okay? 0.4% of people who actually get COVID actually die. And 80% of those people are over the age of 70 and had at least one underlying health condition. So again, 99.6% of people who get it actually survive it. That's not a very devastating statistic, is it? Now, if only 50% of people survive COVID, that would be a bigger deal, right? But 99.6. And anybody under 20 years of age, it's pretty much statistically 0% of people under 20 who actually die from COVID, okay? So now about 80% of positive cases are false positives, and that's been proven over the last year. Now, the PCR test was never invented to test for COVID. And when the test is done, and when they use 40 cycles or more doing the test, they will test positive for most people, even though they don't have COVID. Now, if the test is done using only 28 cycles or less, then very few people will test for COVID, okay? People will test positive. So that's the thing. So they put the cycles up to over 40, which makes it so almost everybody's positive. And here's a joke, everybody. Again, Elon Musk did this probably about 6 or 7 months ago, where he did 4 PCR tests in the same day. 2 were negative, 2 were positive. Okay, he did it on himself, 2 negative, 2 positive. So figure that out. Another guy, a scientist in front of his class at college, did a test and stuck the PCR test into a glass of Coca-Cola, and it came back positive COVID. A glass of Coca-Cola. Okay, so again, the test is so ridiculous, but it's now, remember when they first started this, where all of a sudden how many people were dying from COVID? That was the big statistic. Well, then when the numbers went down, then they started scaring everybody with how many positive tests or how many cases. Oh, the cases are going up. Well, who cares if the cases are going up if the deaths are going down? Okay, so that's what they never really told you about, all right? So that's what's really interesting about this whole PCR test. Most of them, you test positive because it's at 40 cycles or more. And now what's interesting is anybody who's had the vaccine, when they go in for a COVID test now, they take the test for that and they make it at 28 cycles or less. So what does that mean? That means that when you take COVID and you go get a test done now, they do it at the lower cycles, which means less people are going to test positive once they've had the vaccine. If you haven't had the vaccine, they run it at 40 cycles, so you have a higher chance of being positive. So they're going to use that data, which is fuzzy math, to show that, oh, vaccinated people have less COVID, ones that don't have more COVID. And what does that do? That's going to try and scare you into getting the vaccine. And watch what's going on. You got to do a little bit of research, but I'm giving you the highlights. Okay, next thing, masks. Masks don't protect you against COVID, period. They never have and they never will. Again, period. Okay, the pores in the mask are larger than the virus. Here's the pores. Here's the virus. They don't work. They never have. It's all just to try and keep you under control. It's not about health. It's all about fear, trying to isolate people, separate people. See, listen, it's not enough anymore how the world's dividing us, where you have Democrat, Republicans. We have black against white, got the race thing. Now we got mask versus no mask. We got vaccine versus no vaccine. It's all about division. Everybody, that's what this is all about. Instead of just like, you know what? Love everybody. It's your choice what you want to do. Now, let's go to the vaccine real quick. Okay, the vaccines are experimental and got approved to use under what's called emergency use authorization. They're not approved by the FDA as a safe vaccine. Now, here's the other thing. If you or a loved one dies or has a serious side effect from getting the vaccine, The manufacturers are not held liable. I want you to think about that. That means your brother, your sister, your mom, your wife, your whatever could get the vaccine today, die tomorrow from the vaccine, and you cannot sue the manufacturer for producing a product that killed your family member. Now, I want you to wrap your head around that, okay? That's pretty sinister. Like, if they're not confident enough in the safety and effectiveness of their vaccine to where they want to get this liability shield, then what does that tell you? See, if this is a safe vaccine, just like any doctor, right? If you go to a doctor and the doctor prescribes something and you get a bad reaction, you can sue the doctor for malpractice, okay? There's insurance that covers that in case you get injured. Well, guess what? It's not the same thing with the vaccine. You take this vaccine and you die, there's nowhere you can go. It's like, sorry, tough luck, you took it, you're a risk. So again, I want you to think about that before you get it, okay? Now, also, if you think the vaccine protects you, and you get the vaccine, right? Then why would you be concerned if someone else doesn't get it? See, I've asked this question 1,000 times to people, and it just like, you can see their eyes roll back and they're like, they don't get it, right? If you believe the vaccine protects you, then what do you have to fear from someone who's not vaccinated? Period, right? If you got it and you're just protected, what does it matter? You're protected. So back off the people that don't want it. Listen, masks and vaccines should be optional, not mandatory, and that's forever. They should never be mandatory, ever. It's your choice, your body, right? Remember that whole thing, my body, my choice, right? You should be free to get the vaccine and wear a mask forever if you want, okay? But if you feel those protect you, then you shouldn't care about people who don't wear a mask or get the vaccine. You can't have it both ways. You can't think the mask and the vaccine protects you and then at the other side be scared somebody doesn't have it. Doesn't make any sense, right? Doesn't make sense. So here's another an analogy. Now, how would you feel if someone forced you to not wear a mask or get vaccinated if you wanted it? Imagine you went to your doctor and said, Doc, I want to wear a mask, I want to get a vaccine. Your doctor says, no, you can't have it. How would that make you feel? Right? It's your choice, right? It's your body, your choice. If you want to wear a mask, you want to get a vaccine, you should have the right to do that because it's your body, right? Okay, so then how do you think people feel about being forced to wear a mask or get a vaccine when they don't want it? I really want you to think about that, okay? Again, you can't have it both ways. I want you to really put yourself in other people's shoes. But the bottom line is, again, everybody, if you feel that it protects you, get it. I don't care if you wear a hazmat suit from head to toe for the rest of your life with 20 masks and get 20 shots. That's your choice. It's your body, okay? The deal is you need to get all the information about the pros and cons and decide for yourself. But don't push your philosophy and beliefs onto other people. Remember, healthcare choices are personal and private, and it's your body, your choice. Nobody should be able to force you to get something or prevent you from getting it if you actually want it. That's what makes this country great, is it's our choice. Okay, so a lot of that got taken away for about a year or so last year because of all the fear and everything else. But luckily now we have some states like Florida, Texas, etc. They're saying enough of the nonsense. It's people's choice now. And guess what right now? We're taping this show right now in July of 2021. And you go outside, guess what? There's still some people wearing masks. That's fine. And there's lots of people who have been vaccinated, some that haven't. Okay, it's fine, right? It's their choice. I don't look at somebody in a negative way if they're wearing a mask. Like, again, in deep down, I'm like, hey, you don't need to wear that, but hey, it's your choice. I don't care. But when they used to look at us for not wearing one and think we're some kind of a criminal and trying to hurt grandma and all this other stuff, it was just nonsense. It's just not based on science. It was all based on fear. And again, just like with any kind of healthcare choice, you should have been given all the options. Here's the pros, here's the cons. You get to choose which way you want to go and just leave it at that. That would have made it so much simpler the last 18 months of life around the world. But instead, it was mandates and forcing and lawsuits and this and arrests and all this. It was just so crazy. Again, all about dividing people instead of just letting them live. It's like, you know what? It's like race, it's like religion, sexual preference, whatever. You know what? I don't care about that. I just love people because they're a person. You know, I'm colorblind with the way that goes. I don't care if you're gay, straight, homosexual, whatever, LBG, that doesn't matter to me. It's your choice, right? You're a human being. We got to respect that. But somehow with healthcare and all this COVID thing, we're getting away from that. We're getting into all this fear and mandates and forcing and locking down and crushing businesses and having kids have depression because they can't go to school. They've been wearing masks. I mean, all this stuff, it's so crazy. And so I'm really, really tired of it. I think most people are as well. And so again, I want you to have that philosophy again. It's your body, your choice. And so respect that for other people as well. Okay, regardless of where you fall on the spectrum, right? Do your own research and you get to choose, okay? Okay, so that's it for now. I could go on and on. We're going to do another one of these probably in a couple of weeks with some more questions. I get questions coming in all the time. So hopefully that answers a lot of questions that you might have had as well, because those are very common, the questions I covered today. Okay, so I want to thank you for watching this episode of Best of the Best. Have an awesome day. We'll see you next time. Have a great day. Bye.